Good morning. My name is Caroline Danielson, and I am the Vice President of Research and a Senior Fellow at the Public Policy Institute of California. Welcome to our virtual program today featuring the findings from PPIC's report, California's Changing Childcare Landscape, Understanding Costs and Supply. The report, technical appendix, policy brief, and slides from today's briefing can be found on our website at ppic.org. This research and event are supported with funding from the Administration for Children and Families of the United States Department of Health and Human Services. We'd like to thank them for their support. For today's program, I will present some of the key findings from the report. Then I will be joined by my colleagues and co-authors, Joe Hayes and Patty Malagon, for a discussion of the key takeaways and to answer questions from our virtual audience. If you have a question, please send it along with your name and organization to the email address on the screen, ppiceventquestions@gmail.com. As a reminder, PPIC is a public charity and does not take or support positions on any ballot measure or legislation, nor does it support, endorse, or oppose any political parties or candidates for public office. And now I'll begin today's presentation. Our report today focuses on affordability for families and sustainability for providers in light of the state's action to expand and integrate publicly supported care for California's young children. I'd like to acknowledge my co-authors on this work. As well, we have benefited from our grantee community of practice and our engagement with our lead agency partner, the State Department of Social Services. However, all of the findings of the work are ours alone and do not reflect the Administration for Children and Families or the State Department of Social Services. Research shows that childcare is important for both children's later life success and families' immediate economic well-being. For example, studies find that access to publicly supported childcare leads to an increase in parents' employment and can have positive effects, particularly on children's longer-term outcomes like high school graduation. However, it is expensive. Looking across provider types, for example, center-based care and family home care, and also across age of child, for example, infants versus preschoolers, typical market rates for childcare cost families between 6 and 28% of their typical or median incomes across the state. These childcare amounts are from a survey conducted for the state called the Regional Market Rate Survey that was last fielded in 2021. There are some key differences. Infant care tends to be more expensive than care for preschoolers, and family homes tend to be less expensive than child care centers. Across the state, care is also more expensive in higher cost of living counties, but it's actually a higher percentage of family incomes in low-income counties. For example, center-based infant care ranges from about $16,000 to $23,000 per year at the median across counties, and this is in 2023 dollars. But as a ratio of typical incomes, it ranges from 26% in low-income counties to 19% in a high-income county. And we will talk more about regional differences in the next section of this presentation. Perhaps because of the expense, PPIC's statewide survey finds that 3/4 of Californians support more public funding for childcare to help parents work. This is higher than the share supporting publicly funded free tuition at the state's 2- and 4-year colleges. At this point in time, there is not enough childcare to go around. While the true extent of unmet need is unknown, it seems clear that some families who need care are not able to find or afford it. To address unmet need and improve the quality of early learning services for families to brighten their future prospects, the state has engaged in some key investments. In December 2020, the state released its master plan on early learning and care to guide its improvements. One of the overarching goals outlined in the report is to improve the affordability of early care and education. Our report focuses on this dimension, although other dimensions are also important, namely access and quality. Key initiatives undertaken since 2020 include increasing slots for subsidized programs, reforming the payment structure for subsidized programs, also known as a single rate structure or alternative methodology, and expanding the K-12 school system to allow for a full year of pre-kindergarten, known in California as transitional kindergarten, or TK. This chart shows a bird's eye view of the investments between 2015 and 2025, including state funds, the dark blue and light blue segments, and federal funds, the orange segments of each bar. The combined total funds nearly tripled between 2015 and 2025, and mainly between 2020 and 2022, even after accounting for inflation. You'll note that federal funds grew dramatically during the COVID-19 pandemic, but have tapered off since. Nonetheless, state investments have made up the difference so that the funding level has remained roughly constant over the past 3 years. And while there is growth in Prop 98 funds, which mainly go to TK, there's actually larger growth in funds for subsidized care outside of the K-12 system. Slicing the data in a different way, by program rather than funding source, and focusing on the most recent available year, here are the main programs that make up California's early care and education landscape. The programs shown in orange are managed by the State Department of Social Services via counties and the contracts with local entities that deliver child care services. These programs make up nearly half of VCE funding in 2024-25. The segments shown in blue are overseen by the State Department of Education and are used locally by contractors and school districts, and they make up about 40% of VCE funding. The remaining share is federal funds for Head Start and Early Head Start through grants, again to local contractors by the federal government. We find that most licensed providers are part of the public funding landscape in the sense that at least some of the children they care for receive public funding support. Unfortunately, we do not have a good handle on the total number of license exempt or family, friend, and neighbor providers. We do know that over 30,000 license exempt providers receive payments from the state's Child Care and Development Fund block grant. We do have a better handle on the share of family homes and center-based providers that accept some public funding, while there's still data limitations. What we find for these providers is that over half of family child care homes have funding from the CCDF block grant, and around 80% of child care centers accept federal or state funds through programs managed by Department of Social Services, Department of Education, and the Federal Head Start Office. And finally, TK is directly funded through local districts and California's public school funding formula. As I've mentioned, subsidized payments have been growing, and this figure shows monthly payments paid by the state on average to many publicly supported providers over the past decade. The vertical axis is the monthly full-time rate. The bars show the subsidized rates, and the dots show the amounts providers reported charging for private pay care, or the market rate. And here we're showing the 75th and 85th percentile market rates, which means that 75 to 85% of providers reported charging less than these rates. We show these because the 75th percentile is often used as a benchmark for setting subsidized rates. Statewide, subsidized rates have grown by about 8% above inflation between 2021 and 2025. And the dots here show that compared to market rates, subsidized payments have been gradually catching up to the 75th percentile market rate. And they've grown further since, although we lack updated information about market rates in 2025 as a point of comparison. And I should note that in 2021, 2020, and 2025, in both years, subsidized rates do include pandemic and additional payments known as cost of care plus payments. Not shown in this slide is quite a bit of regional variation, which we'll turn to discussing in the next section of this presentation. Some increased funding, which led to more spaces in child care homes and centers and to the expansion of TK, along with increased payments to subsidized providers, appear to have had some early successes. This chart shows statewide trends since 2015, comparing the overall number of children under age 5 from census data, and equivalent to about 2 million children in 2023. And it compares it to the number of early care and education spaces in centers, homes, and TK. These numbers are shown in thousands. Due to data limitations, again, we've excluded family, friend, and neighbor care from this chart. The overall picture shown is one of increasing capacity, driven by the increase in TK enrollment. A bigger change is actually the declining population of young children, which ultimately is leading to a narrowing of the gap between the overall number of children and childcare capacity. However, again, we are not able to measure the extent of the true unmet need. While the overall growth in childcare spaces is driven by TK, there are bright spots in the licensed childcare supply as well. This chart is showing the growth in capacity. That is the total number of children that a provider is licensed to care for by type of licensed provider, which we split into centers, large family homes, and small family homes. Orange indicates centers, green, large family homes, and blue, small family homes. Bars below 0 show annual declines in capacity, which was true of small family homes for most of this period. Bars above 0 show increases, which was true in the early part of the period for centers and from 2020 of large family homes. Particularly in 2022 through 2024, both small and large family homes have begun to grow. Centers have not shown so much growth in capacity, however, their changes have been relatively small. In our research, we also conducted a survey of navigators across the state who help connect families to childcare and providers to the subsidy system. These include resource and referral agencies, alternative payment groups, and local planning councils. And we conducted 10 focus groups of families and providers who have experience of subsidized care. Although our data from licensing and K-12 sources show increases in child care supply and an increase in payment rates and funding, a majority of navigators who responded to our survey said that the supply of subsidized care had declined recently. Some of these responses could reflect regional differences, which we'll turn to in a minute. They could also reflect respondents' focus on childcare providers rather than on TK. Nonetheless, there was a notable difference of perception between our data sources. However, on that latter point, navigators do believe that the expansion of TK to include all 4-year-olds is affecting subsidized providers. The vast majority report that some or a lot of 4-year-olds are leaving childcare to attend TK or are enrolling in both TK and childcare. They also report that TK expansion is making it more difficult to staff childcare programs. At the same time, most navigators and indeed focus group respondents, both on the family and provider side, believe that for families, affordability has increased in recent years. This could be due to the state's revised family fee policy, which has reduced out-of-pocket costs for families accessing subsidized care. It could also be due to the expansion of TK, which again offers a free option for 4-year-olds. To wrap up, the state is working to implement the vision of an integrated, high-quality early learning and care system for California's children. As it does this, the entire system is adjusting. We find that the supply of care has increased and that families and providers believe that affordability has increased. However, challenges remain, particularly for younger children, as providers appear to be working to adjust to a greater focus on this age group. We believe that further integrating data across this still complex landscape would give policymakers a better picture and ability to monitor the system and make adjustments. And in our own research, we will continue to examine the rollout of upcoming changes, particularly to the system of subsidized childcare, and we will be examining dimensions of access beyond cost, such as supporting parents' employment or training in children's continuity of care. Now, let me welcome my co-authors, Joe Hayes and Patty Malagon, for a discussion of the findings. So as I've noted in my presentation a few times, while there are some important statewide takeaways, there are also some key regional differences. So in this section of the presentation, we'd like to dig a bit further into those differences. So let me start by talking about the regions that we use in our research. So we use 5 regions defined in terms of their cost of living, and the cost of living with a particular focus on living wages. The lowest cost region is mainly northern and inland counties, while the middle cost region is Los Angeles County, and the highest cost region is made up of many Bay Area counties. And these regions were developed by the state for the State Department of Social Services. So let me start with you, Patty. Can you talk a little bit about the regional variation in the cost of childcare?
Yeah, sure. And thank you, Caroline. I think earlier in your presentation, you walked us through the statewide picture of subsidized rates and market rates or private pay rates. But it's also important to note that these rates actually vary by county. And in the report, we aggregate to these single rate regions that you just described. If we look at across these regions, we find a similar pattern. Subsidized rates have gone up over the past decade. And in general, I think you also mentioned it in your presentation, but these rates are higher in the highest income regions, but providers are still being paid somewhere between the 75th and 85th percentiles of the private pay rates. And if we look, at the county level, and earlier you brought up how the latest regional market rate survey is from 2021. So we look at those median percentiles, we see that there are discrepancies or differences across counties. So prices in San Francisco are more than double what they are in Tehama County, which is a county up north. And this is true this is true across age groups and also provider types. And then just to, tie everything together, subsidized rates have, increased. And this is partly because of supplemental rate payments that started during the pandemic. And since most have tapered off, but also, I think in the focus groups, which maybe we'll discuss in a little bit, but providers and families also note that it's important for these rates to keep up with the cost of living and just financial demands of running childcare programs. So that's a little bit on the cost of childcare in California, but I think there are also, other regional differences, and I can hand it off to Joe to talk a little bit about what he found.
Happy to. Thanks, Patty. So we asked navigators about a range of their experiences. And depending on the topic, navigator perceptions can vary noticeably by region. Again, as Caroline pointed out, navigators is the term we're using for professionals who help connect families with childcare providers offering subsidized care, and also connect providers with the state subsidy system. So in the lowest cost regions, the clear majority of navigators responded that supply had decreased. That is to say 61%, 65% respectively in regions 1 and 2, the lower cost regions. In Los Angeles, 75% of respondents said that subsidized care slots for children 0 to 5 had decreased during that time. But in the higher cost regions, only about a third of respondents said that supply had decreased, with about half saying that it had increased, and the remainder saying that in their estimation it had stayed the same. With regard to the expansion of transitional kindergarten eligibility, navigators in the different regions seem to largely agree. Large majorities of respondents, anywhere between 66 and 84% across each of the regions, said that TK expansion had affected their ability to staff childcare programs. And with respect to affordability, again, there's some difference by region. In each of the lower cost regions, about 60% of navigators told us that the affordability of subsidized care had increased in recent years, while about 30% said that it had decreased. In Los Angeles, the middle region, and also in region 4, respondents were kind of evenly split between increased and decreased affordability. But in the highest cost region, region 5, only a third said that affordability had increased, with more than half saying that care had actually become less affordable during that time.
Interesting. Yeah, and just turning back to the data we have on licensed supply, there is some regional differences. There are also some similarities. So across regions, there's a similar picture of increasing early care and education spaces, with the largest increase coming from TK across regions. We do see some actual declines in licensed provider supply in Los Angeles. They're in center-based spaces, did decline. And in the next higher cost of living region, Region 4. And we saw a decline in family childcare home slots in the highest cost of living region. However, at the same time, we also see larger declines in the young child population in the higher cost regions as compared to the lower cost regions, although across the state, we've seen a decline in the young child population. And I'd just say as a final pointer on the supply and regional differences that although we've seen some drops in capacity in higher income regions and licensed provider capacity, the higher cost regions continue to have the greatest number of spaces per young children as compared to lower cost regions. They have fewer spaces per child. But it is interesting that we do see this divergence across our survey and licensing data sources. And so, Joe, can you tell us a little more about some reasons why that might be the case, why we're seeing this divergence?
Sure. So you noted that overall, the administrative data show that the number of early care and education slots is now 6% higher than before the pandemic. And you talked about how that increase owes in some growth in some part to the growth of supply in home-based childcare and obviously the TK enrollment expansion. But as I mentioned earlier, more than half of the child care navigators that we talked to said that the supply of household care for children 0 to 5 had decreased in recent years. So why the disconnect? There are a few reasons for this. It's possible, first, that navigators are responding to changes in centers and family homes rather than necessarily factoring in the increase in TK availability, although, of course, they're aware of that change. If we exclude TK, licensed capacity did increase, but only by less than 1% from 2020 to 2023. So it's possible they were really focusing on what we think of as childcare rather than school. Also, regional differences emerge as we started to talk about as an explanation as well. The capacity of licensed providers did actually decline in Los Angeles County, Region 3, where 3/4 of our navigators also identified a decline in supply. It's possible also that navigators were responding to the number of providers that they're serving rather than the number of slots. The number of center-based providers did decline each year from 2020 to 2023, and the number of family childcare homes declined through 2022, eventually turned around. It could be that they're again focused on the number of providers that they're dealing with rather than the number of slots. And the last thing I'll say about it is I think it's worth mentioning that the administrative data estimates could easily be overstating the actual number of slots available at any given time. For example, with respect to variation in the ages of children enrolled, that can change the number. Just to give an example, a licensed capacity of a family home provider might be 8, for instance, but the actual number of kids that they can care for will be smaller if a higher share of those children are infants. So if there's 2 or 3 infants among that group, the licensed capacity might just be 5 or 6 instead. That won't show up in the administrative data, but it will show up in the navigator's perceptions of who they can actually provide a slot for when they're dealing with families.
Yeah, thank you, Joe. I think we're ready to transition to taking questions from the audience. As a reminder, if you have a question for us, please go ahead and email it to ppiceventquestions@gmail.com and be sure to include your name and organization. Our first audience question is from First 5 Marin, and it is, how do you explain the discrepancy between the high cost of childcare and the low wages that most child care workers are paid? Yeah, this is a good question. Childcare is human capital intensive, so it's expensive. As the questioner points out, rates are not always competitive, and providers often make low wages. So we don't expect childcare to actually become cheaper. It's human capital intensive because, as Joe just mentioned, the ratios, especially for the youngest children, are quite low, and that's determined to keep the quality of childcare high. It's an investment that many of the state's residents do support, and it's an increasing investment the state has made over recent years. Our next question from Sacramento is, are there differences in access and affordability of care for different age groups? Patty, do you want to take that question?
Yeah, sure. Yeah, I think I can share a little bit maybe from the provider side of things. But I think Caroline, you talked about how infant care tends to cost more, and not just compared to other age groups, but also when you compare to center and home-based settings. And these higher costs for infants could be attributed to the unique needs of infants. They tend to be more dependent on an adult. And adult to child ratios, Joe mentioned a little bit about this on the family home-based side of things. And also there are extra requirements like individual sleeping plans, keeping track of nap times and checking in on the infant. I think for a center, the adult to child ratio is like 1 teacher for every 4 infants, which is crazy. And also, on the survey side of things, we found that only 31% of navigators said that families were able to find affordable care for infants, but this number rose to, I think, close to like 80% for preschoolers. And this also reflects, probably the state's investment in preschool, which you and Joe have talked about. And then, just from focus groups, from parents across just different counties, we heard that there are waiting lists. And just like navigating the childcare system or subsidy system also adds like another layer to access. And just to, the report focuses on infants and preschool age children, but there are also other school aged children with different like subsidized rates and needs. So that's another, there are differences across age groups.
Yeah, got it. We have a second question from Los Angeles, which is, do you have any insights on changes in affordability from our focus groups from families and providers? Are they feeling the impacts of the recent increases in funding?
I think I can answer this one, maybe Caroline, and also, feel free to add anything, Joe. But from the survey, about half of navigators said that and I think Caroline brought this up too in her presentation, but affordability had increased. And one of the most common reasons were family fee waivers during the pandemic. And I think navigators also identified this increased affordability as starting in 2023. And this was around the same time when the state directed that families below 75% of the state median income would pay no family fee, and other families were capped at 1% of the family income. And I think another common reason that we heard in the survey was changes in eligibility, and this, could also be related to the increased number of preschool slots in TK. And I think in 2023 there was also some or the state passed like a Senate bill 1047 that extended categorical eligibility to families participating in other safety net programs. So there are a lot of just changes that go back to like the policy and state actions that have been going on in the past few years.
Thank you.
Yeah, there are a couple things I could say about that as well. Just taking off on what Patty's pointed out. In the navigator survey, most of our navigators said that the affordability of childcare had improved. But that changes based on the age groups, as I think you were alluding to. Overall, 77% said that families could find affordable care for preschool age kids. For toddlers, only 56% of navigators said that families could reliably find appropriate affordable care. And for infants, if the figure is down to 31%. So the concerns that Patty pointed out earlier about the ratio of care for different ages of kids is clearly at work here. And of those who said that affordability had increased, about 70% of those attributed the improvement to changes in eligibility, and about the same percent cited the family fee waivers that Patty brought up, issued in response to the pandemic. And I should point out that respondents were permitted to cite more than one reason for these changes that they saw.
We have another question on the age composition of children in subsidized childcare. I know I've mentioned the expansion of TK, which serves only 4-year-olds. Joe, do you want to talk a little bit more about how that's playing out for subsidized childcare providers and subsidized care system?
Yeah, well, we learned more about this when we were talking to navigators about the effect of TK expansion, for instance. The overwhelming majority of our respondents said that at least some kids are leaving care to attend TK, and that there's broad agreement across different types of navigators and different regions about that. Beyond the sheer numbers, though, TK expansion does appear to be changing the composition of childcare enrollment. And again, age composition is foremost in this. More than half of navigators identified this trend, and understandably, nearly 3/4 said they were being asked to place fewer 4-year-olds, obviously the age newly eligible for TK. Correspondingly, about half of the navigators told us that they were placing more toddlers and 3-year-olds, and 1/4 said more infants. And again, respondents are free to identify multiple effects in this question. So the shift in composition obviously presents some challenges for providers because staffing ratios, licensing requirements, and the necessary training and experience are going to be different for younger children than for preschoolers.
Here's a question about trends. Trends in provider turnover, not just in provider supply, which I spoke to earlier. Yeah, in terms of turnover, we do look at in our research how often licensed providers open and close. The trends that I think are most worth focusing on to get a picture are those for childcare centers and small family homes, and there's really a stark contrast. Centers have consistently low turnover, about 4 to 5% open and close each year, and that's been pretty consistent over the past decade. In small family homes, in contrast, there's a higher both open and close rate. And there's also been a huge uptick in recent years. In 2025, the opening rate for small family homes, it was above 25% in 2023. A smaller share, but still 15% closed in 2023 approximately. This means that the number of small family homes is growing because the closings is lower than the openings, but still there's a pretty high rate of opening and closings, and it's understandable from the perspective of small business where the loss of a staff member or for other reasons means that the business may need to close. The upshot of this is that half of center-based providers have been open for 16 or more years. But when we look at small family homes, half have been open for 4 or more years. So the level of experience with this more turnover in small family homes is less. Small family homes are also more likely to become temporarily inactive. So stop providing for children or taking care of children, then return to taking care of children. This was about 11% in 2022. Versus 2 to 3% for centers. So we do see some notable differences in turnover across the licensed providers that we looked at in our data. We have a question from the University of Southern California, which is, since TK is shifting the age composition of children participating in childcare centers and family homes to a younger age group, how do you see the childcare providers adapting to the stricter regulations, especially in the child to staff ratio? Joe, is there anything from our navigator survey that could help us to address this question? It wasn't a key, it was sort of a finding of our research that's worth more investigation rather than a key focus of trying to understand how they're adapting. But let me hand it over to you to talk about the survey again.
Surely, yeah, I can corroborate that it is a problem that navigators are aware of. I don't have too much to say about the strategies that either family homes or centers are employing to deal with this, but we did ask them, navigators, for instance, about turnover. Nearly half of the navigators said that turnover among providers had increased recently. only 20% said it had decreased, and the third said it hadn't changed. But what I wanted to say about it is that those who did report an increase in turnover most commonly cited staff wages, working conditions, and benefits, as well as general economic conditions as drivers, which gets back to the first question we had about the discrepancy between the high cost of care and then the low wages experienced by the providers themselves. So in our discussions with the navigators, they really did point up this increased difficulty in managing the increasing costs because of higher requirements for how shall I put this? Higher requirements for lower staff ratios for younger kids, of which they are seeing more now, in part because of TK expansion, but also because of the other trends that we've identified here.
Thank you. Question from Oakland. Do providers have preferences on serving families who pay tuition and fees themselves versus families who receive subsidized care? Patty, can you speak to that one?
Yeah. I think we touched briefly on this in the navigator survey. So we asked navigators for their perspectives on provider experiences serving families who are private payers or families receiving subsidized care, and about half said that providers received payment with more reliability under the subsidy program. And, navigators also sense that providers had a much larger administrative burden serving families under the subsidy program. And I think just, also overall, this isn't part of the navigator survey, but licensed providers, they need to keep track records of the children's, whether they're, receiving subsidy or, they're private payers. So there's all that paperwork and administrative work that providers need to do to run their childcare programs, and also just different incentives for providers, whether they accept or they work more with families in the subsidy system or private paying families, like ease of filling vacancies or just the amount of money that each program may pay for the child. Those could be shape the provider preferences.
Thank you. Our last question is, do we know how many families who demonstrate need for childcare actually receive subsidies? And why do some eligible families not receive subsidized care? So we do know from others' research that eligible 4-year-olds have much more access than younger children, and infants have the least access. And we've alluded to some reasons for this and how the system is actually changing to further increase access for 4-year-olds. And infants are, correspondingly, there's been some increased difficulty in placing infants. And we've heard this across our data collection. We're also embarking on additional research in the future to measure the reach of subsidized care in different parts of the state and for different age groups. This is a question that really interests us. And we also, in this research, plan to document some of the key aspects of the experiences of children, particularly around continuity of care, and of families and around parents' employment who do access subsidized child care. So also stay tuned, because we're digging into some of these questions in our future research. Joe, let me turn it over to you to close us out today.
Yes, indeed. We have reached the end of our program today. So I want to thank Caroline for her presentation. I want to thank Caroline and Patty for joining me for today's discussion. And I'd also like to thank our funder, the Administration for Children and Families, ACF, of the United States Department of Health and Human Services. And thanks to all of you for joining us online. We would appreciate you taking a moment to give us your feedback on this event, if you would. If you pre-registered for the event, you'll receive an email later today with a link to a short survey, but you can also scan the QR code that appears on your screen right now. And finally, recording of today's event will be available on the PPIC website and also on our YouTube channel, so you can watch it again or share it with your network. Thank you for joining us, and have a good afternoon.